Psychologist and says that much of the city is suffering from post-traumatic stress disorder. You may not even know it. Welcome, Dr. Elligan. How are you?
I'm good.
Post-traumatic stress syndrome, I mean, from what? We didn't have a 9/11. We didn't have a big hurricane. We didn't have a war go on here. That's what you think of when you think of PST. You know, what is it? Post-traumatic PTSD. I'm sorry.
So PTSD typically involves a person who experiences a traumatic event and then has ongoing psychological consequences as a result of that traumatic event. They may have nightmares, flashbacks, a startle response, so that they hear something loud, they jump out of their seats, poor concentration, difficulty with attention and focus, and it continues to haunt them well after the traumatic event.
So what you're saying is all of this violence is causing people to have this?
Absolutely. One of the leading causes of PTSD, actually, unknown to many, is auto accidents. And it's one of the leading causes because so many people experience an auto accident. After an accident, they have difficulty getting back into a car, flashbacks, thoughts about the accident. So if that's a common cause, we know that witnessing violence from a very early age in a community can be traumatizing and lead to nightmares, flashbacks, fear of becoming the next victim, and that can begin to generate some PTSD. You mentioned 9/11. A lot of people also can experience vicarious PTSD. So even if you weren't in New York during 9/11, but because you continue to see the same images over and over on the television, a lot of people then develop some PTSD symptoms secondary to all the media coverage.
Speaking of media, which is what we do here, so are we causing some issues, you think? Or should we not be reporting this or doing more stories like Gaynor did to find solutions?
Absolutely. I think the important thing is doing more stories to find solutions and alternative ways of managing situations that bring about fear, coming up with solutions on how to manage the aggression and violence that we see in the community, as opposed to glorifying it. So a lot of the media isn't just the news coverage, it's also things that we see in movies.
Right, and we see a lot of it in movies.
Video games, you know, so we have this glorification of violence and aggression that is seen throughout all the outlets of media.
And it's hard to get over because it is there. So we see this particularly, I think, probably, and you tell me if I'm wrong, in the African-American community.
Absolutely. So one of the leading issues within the African-American community that oftentimes isn't discussed is single-parent households. So the national average is about 70% of African-American children are raised in a single-parent household. In Illinois, that number is
what's the percentage?
70%.
Oh, my goodness.
And in Illinois, the number is actually a little bit higher, 75%. So that, you know, being raised in a single-parent household can lead to being at risk for a variety of factors. Poor performance in school, problems with negotiation and conflict management.
Because they're not seeing the two partners or whomever is raising the children. They're not seeing two people trying to resolve conflict, trying to have a loving relationship. So they don't see any of that. So they kind of make it up on their own.
Right, exactly. And if you don't have those learning strategies, when you have a conflictual relationship or situation, one of the easiest ways to resolve it is through aggression and violence.
And another thing that I've heard, and after, you know, from talking to people, is that especially for men, they need some type of father figure or someone like that, so they kind of find it elsewhere in gang leaders and things like that. Is that true?
Possibly, absolutely. I mean, it could be possible. In that segment that we saw earlier, the young man mentioned that he had been in a gang and had regrets about some of the aggressive behavior he displayed, but kind of couldn't stop. So the gang may be a place where they're searching for that type of father figure acceptance, but definitely joining a gang is going to reinforce a lot of these ideas about what it is to be a man, masculinity, and how that's related to violence and aggression.
Okay, Dr. Elligan, hold on, because we're going to come back. We're going to take a quick break. More with Dr. Elligan when we return. Welcome back to People. I'm Micah Matera. We're here with Dr. Don Elligan from the University of Chicago, and you see that, and you hear people pleading for the clinics to come back. Would that help with our violence, getting folks help who are mentally ill?
Absolutely. I think access to help is one of the critical issues that can help intervene with some of the difficulties that we're having, and also prevention programs. And a lot of community health programs and community health agencies spent a lot of their resources on kind of public health prevention campaigns. And the lack of prevention campaigns really can breed a lot of the violence that we're seeing in the community.
You heard in the last segment, Gaynor Hall talked to a gentleman who was a repeat offender, and he said that you lock people up, you lock them up, but unless they want to change, it's not going to make a difference. So once they're locked up, what should we be doing to help them to change their mind?
So I agree with Gaynor completely, and I think locking them up is just a form of punishment. And most of the research has found that punishment without some sort of rehabilitation, learning, or teaching is really useless. The prisons have to incorporate some sort of rehabilitation or training programs. I mean, in many parts, what I do as a psychologist through psychotherapy, a synonym would be educating people. So we could be educating prisoners about how to manage anger a little bit better.
It sounds expensive, though, and that's what, of course, the government's saying. That's expensive. Do we have the manpower? Do we have the money to do that?
Well, the psychologists are already present in many of the prisons, and educators are present in prisons. So we're just really talking about focusing on an intervention that's slightly different than what they're doing. I mean, people go into prison and come out with degrees all the time. So there are a lot of resources already in place, and that could be done on, a large scale with groups of people as opposed to individually. So I'm not sure if it would really require a lot more financial resources.
Right. Dr. Elligan, before they get to prison, what can we do? Is there a solution? I mean, I ask people all the time, is there a solution to this violence? You would think with all the money America has, with all the resources we have, why can't we solve this killing field that is out there, especially in the city of Chicago here of late?
Yeah. So I think prevention is the key. And as you brought up this last segment about the closing of a lot of the community health centers, which leads to homelessness, one of the things that's lost is a lot of these public health campaigns to educate people in advance of committing aggressive crimes, of alternative ways of managing their emotions and alternative ways of handling the difficulties that they're experiencing. So education, public health, public service announcements, programs like this, I think could serve a significant role in helping to resolve some of these issues.
Talking about specifically the African American community, do we shy away from the words mental health, mental illness?
I think that's a stereotype, actually.
Okay.
And before moving to Chicago, I worked in Boston in community health, and many of the clients that would take advantage of our services were people of color, primarily African Americans. So, and even some African Americans, I think, look at mental health as an extension of social service. So the idea of seeing someone isn't that foreign.
So if I get you right after talking to you for the few minutes that we have, number one, we've got to start in the home. We've got to stop these single-parent families because that's prevalent in the African American community, and that's what's causing some of this violence because they don't know how to, deal with the problem solving and the conflict resolution. Number two, we have to deal with mental illness a little bit better. We have to open up more clinics and put more money, more funding in there. And number three, prevention, and that is more education and things like that. And once they do, number four, get into the system, they've got to work harder to try to change their thinking into letting them know that they don't want to do this. They don't want to. They want to change their mind and not commit violence. Am I right?
Absolutely. I agree. Okay. I agree with your 4-point plan.
Okay. All right. Did I get a PhD now? Dr. Elligan, it's just a problem that we see every day. And why can't it just seems like from what we said, it's a simple solution, but we can't get to it.
Well, I think like we just talked about in that 4-point plan you just laid out, it's a multi-tiered approach. I mean, and you have to start in the home, and it's hard to really get people to change the things that they do behind closed doors. So the government can't really get involved in that. Policy can't get involved in that. And that's where the education becomes important and how we get into this cyclical repetition with single-parent households.
Right. Should those parents be able to see problems before they happen? What about teachers? Can they see problems before they happen?
Teachers, I think, see some of the risk factors and some of the potential for some of this negative behavior to develop down the road. But unless they can get the parents to buy into it, and sometimes that's difficult for a parent to buy into, that someone's telling them that their child is misbehaving or at risk for something. But if they can accept those, I think they could intervene and begin to ameliorate some of these issues.
Right, and we have to pull back on the violence in the media. Thank you very much, sir.